Hello, I'm Pauline Yates, Community Nursery Nurse with Poole West Health Visiting Team.
Hello, I'm Wendy Crawford, Community Nursery Nurse, also from the Poole West Health Visiting Team, and we're here today to give you a short presentation on introducing of solids to your babies. If you have any allergies or intolerance in the family, then please seek advice from your health visiting team.
We're doing this presentation because of the COVID-19 restrictions, and all our information is coming from the Start for Life bite-sized guide to healthy weaning. We realise that all babies are different and some babies may need the introduction of solids a little earlier. If that's the case, then please speak to your health visiting team before doing so.
So after 6 months of age, your baby will need other nutrients and will begin the process of eating family foods. This gives the digestive system time to develop so that it can cope with eating solids.
There are 3 signs that may indicate your baby is ready for introduction of solids. Firstly, that they're able to sit and have good head control. Secondly, that they are able to coordinate their hands, eyes and mouth. And thirdly, that they're able to swallow foods. Babies who aren't ready may push the foods out.
So the recommended age, which we've already said, is 6 months of age, but please be aware that from the supermarkets, jars, pouches and packets, they will say from 4 months of age, so please be aware of this. Waiting until your baby is ready means that they will feed themselves more quickly and be less messy as they can swallow properly.
We would recommend introducing vegetables as a first taste, especially root vegetables, so carrots, potatoes, parsnips, swede, broccoli and sweet potato. Vegetables are preferably first because fruit is naturally sweet and babies will get used to that taste, and then to introduce vegetables may be a little bit more difficult. The fruits to introduce could be melon, pear, avocado or banana, which you can mash or you can use as a finger food.
So the first taste, as Pauline said, you can go with mash, which will be cook up those foods, sieve it and mash it with a fork. Your baby will be quite easily to eat those small lumps and will cope quite easily. Or you can go for the baby-led weaning, the finger foods, where you will cook, say for example, sweet potato, cut it into a finger-sized piece, like a baton, chunky chip, cook it up and then place it on their tray for them to be able to pick it up and then still have food left them that they could put into their mouth. Things like your grapes, cherry, tomatoes, blueberries, orange segments, these are obviously not big enough to cut into those baton size, so you're then looking at cutting it into long quarters for them to be able to swallow it if they don't chew it properly.
To begin with, we would suggest that you offer foods once a day, maybe at lunchtime. It doesn't matter if you offer it between a feed, after a feed or at the beginning of a feed, but if your baby is distressed and upset, then settle them with some milk before doing so. If you're using finger foods, let them explore the foods, and it's not about swallowing and eating, it's about exploring and getting used to having other things. Obviously always stay with them when your baby has food of any description. It's much safer to do so.
So once you've tried those vegetables and fruit, then you can then move on to other tastes, things like your chicken, mashed fish, checking for the bones, pasta, lentils, rice noodles, bread, we recommend the wholemeal bread, yogurts, full fat, babies need full fat, not low fat. Eggs can be soft or hard as long as they've got the lion stamp on them. Then from 8 to 9 months of age, you're moving on to those 3 family meals a day with a mix of mashed and finger foods, and thinking about their portion sizes about the size of their palm.
Just adding in as well, it can take 10 to 15 tastes for your baby to get used to a food, so if they reject it at first, don't worry, just keep offering. And then we look at milks. If you're breastfeeding your baby, carry on with the breastfeeding as and when your baby wants to. Your milk supply will adjust to what your baby needs. If you're formula feeding, again, your baby will adjust what they need and you will find that they will take less formula milk. If you're breastfeeding as well, you need to maybe at 6 months offer a vitamin A, C and D supplement. If you're formula feeding and they're taking more than 500 mils, then you don't need to worry about adding a supplement because the vitamins are already in the milk. We recommend that when they're on 3 meals a day that they have 600 mils or 1 pint of milk in total, so that is also drinking and in their foods, which is actually very easy to achieve. Also from 6 months, when you're cooking, you can use the blue full fats supermarket milk. So if you're making porridge or you're making a custard or a sauce of any description, then you can use that milk. So to confirm, their main drink is formula or breastfeeding, and you can use blue supermarket milk in cooking. By 1 year, we would suggest that they will stop the formula milk and move on to cow's milk, and breastfeeding can carry on as you would like to do so. Then there are cups. We would also recommend when they're having their cups that they have milk or water as a drink rather than anything else. Juices can attack the teeth, so like I say, we suggest that milk or water are the drinks of choice.
So some cups that we have here as examples, we have a cup here, 2 handles, and it's called a 360 cup, that the seal goes all the way round so they can drink from any part of the cup, and they learn quite quickly to use this and can cope very well, and also it doesn't spill. We have another example of a cup with 2 handles. This is an easy flow cup. 2 handles is better because they can hold it with 2 hands, and the coordination is better to get from their hands to the mouth for them to drink it, rather than one and it's going all over the place. And then another cup is one that's got no handles but it's got grips on. But have a look around because there's so many cups available in the supermarkets. So what not to give: salt and sugar. Obviously if you're at home and you're doing your own cooking, then you're not going to put any sort of salt or sugar in your cooking. But be aware of, obviously, if you use your jars, packets or pouches, then they may have hidden salt and sugar in them. Also things like your sweets, snacks like crisps, biscuits, chocolate, we would also not recommend offering these. They're not on the Eat Well guide plates, as well as the juice, squash and fizzy drinks, as they are high in sugar. Honey you can give after 1 year of age. Tea and coffee, again, we don't recommend because this stops your baby from absorbing the iron from the food. You can give smooth peanut butter from 6 months of age. Be aware if there's allergies, because otherwise we would not recommend it, but they can in moderation, and whole nuts is a choking hazard, so again, avoid those.
Hygiene, obviously very important, especially with the restrictions that are around at the moment, so washing your hands is paramount. Also washing your baby's hands is a good idea. They've been playing on the floor and playing with toys, so it's a good habit to get into, to get them to wash their hands before eating. Obviously make sure that your food preparation surfaces are clean, and any utensils that you're using are clean. Wash your fruit and vegetables before using them, and you can batch cook, you can freeze your foods, but when you're freezing them, make sure that they're defrosted well and reheated well. If your baby doesn't complete the meal that you've given them, please don't reheat it another time. Sadly discard it and give them a fresh batch of cooking for the next feed.
So the safety, again, please don't ever leave your baby alone in the high chair, especially whether they're eating or just playing. You need to be aware of things like choking, so please have a look at the Start for Life app, and it will give you some advice on choking, or we would recommend that you go on a first aid course, as very recommendable. Keep the high chairs away from worktops, thinking about things like hot drinks, hot pans, sharp utensils, as we know children like to reach out and grab, so please be aware of where you place your high chair. And obviously again, please use the straps at all times on your high chair.
As your baby grows into a toddler, they're using much more energy and they're putting energy into development. So we would say you could offer a snack, but please use things like breadsticks, crackers, cucumber, cheese, yogurts. So they're a healthy snack, and they're not biscuits and crisps, which just give a sugar fix and don't actually do anything. Eat together when you can. It's a really important part of social development. Your baby is learning from you. How to eat, what to eat, and all your mannerisms. So we would suggest that whenever you can, try and eat as a family or just the two of you. It's about communicating as well. You talk about your day, so your baby is learning speech and language, so it's a very important thing to do if you can. Regular meal times help to establish regular eating habits and good growth for your child as well. So just, if you can, establish those right from the beginning.
The main thing is enjoy the time of introducing those solid foods to your babies. Have fun, let them get in a mess. If you need any further advice, then please contact your health visiting team. But from Pauline and myself, thank you for listening. I hope you found it useful.
Thank you.